The individual is seated on the table with their legs dependent, with the leg being tested slightly extended. The practitioner is seated facing the individual with one hand stabilizing the tibia, while the other hand maintains contact against the medial aspect of the foot. The individual is requested to dorsiflect and invert their foot against the practitioner's resistance.
Hold.
Tibialis posterior. The individual is seated at the edge of the table with their foot plantar flex. The practitioner is seated facing the individual with their hand gripped on the individual's foot. The individual is requested to invert their foot against the practitioner's resistance.
Hold.
Soleus. The individual is lying prone with their knee flexed to 90 degrees and their other foot slightly plantar flexed. The practitioner applies simultaneous pressure superiorly to the heel inferiorly against the ball of the foot. The individual attempts to plantar flex their foot against the practitioner's resistance.
Hold.
Gastrocnemius. The individual is lying prone on the table with their feet hanging just off the edge. The practitioner is standing with their hand on the plantar surface of the individual's foot. The individual is requested to plantar flex their foot against the practitioner's resistance.
Hold.
Prionis longus. Sitting or supine with extremity in medial rotation, examiner supports the leg just above ankle. Eversion of the foot with plantar flexion of the ankle against the lateral border of the plantar surface of the foot in direction of inversion of the foot and dorsiflect of the ankle.
Hold.
Peroneus tertius. Patient is seated, stabilize the foot and ankle in neutral position. Patient is asked to dorsiflect and evert the ankle. Practitioner pushes into plantar flexion and invert the ankle.
Hold.
Flexor hallucis longus. Patient sitting. Stabilize the foot and ankle in neutral position. Patient asks the plantar flex the great toe and told to resist.
Hold.
Patient sitting. Stabilize the foot and ankle in neutral position. Patient asks the plantar flex the great toe and told to resist.
Hold.
Adductor hallucis, patient seated, grasp heel firmly, abduct the great toe from the axil line of the foot against the lateral side of the first metatarsal and proximal phalange.
Hold.
Extensor hallucis longus. Patient sitting, stabilize the foot and ankle in neutral position. Patient asks to dorsiflex the great toe and told to resist.
Hold.
Extensor digitorum longus. Sitting, stabilize the foot in slight plantar flexion. Extension of all joints of the second through fifth digits against the dorsal surface of the toes in direction of flexion.
Hold.
Flexor digitorum longus. Sitting, stabilize the metatarsal with the foot and ankle in neutral position. Flexion of the distal interphalangeal joint in the second through fifth digit against the plantar surface of the toes in direction of extension.
Hold.
Flexor digitorum brevis. Sitting. Stabilization of the proximal phalanges with foot and ankle in neutral position. Flexion of the proximal interphalangeal joints of the second through fifth digits against the plantar surface of the middle phalange of digit 2 through 5 in direction of extension.
Hold.